Here, everybody. It's great to be back here in 2019, a great new year to start over. It's going to be an exciting year, I'm sure, for you all as well as it will be for me. I'm super excited for all the good things that are moving forward. But thank you for joining again, Dr. Brandy's Pearls. Again, this podcast is made for nurse practitioners no matter where you are in your career. But I also plan to have podcasts here and there that will be related to, that will help patients as well as nurse practitioners in their practice. But today I want to definitely shine upon a couple of pearls that I've posted previously. And I wanted to go into a little more detail about that and also tell you a little bit about some of the other things coming up. My first pearl that I wanted to talk about was pearl number 44, where I state that your soap notes need to read like a story. And this is true. And I think I've talked about this several times last year, but I think I want to highlight it a little bit more this time around and state that remember that your soap note is a storyboard. It really gives us as practitioners, as providers, and those that are following behind us and those who we refer to, the opportunity to see the story of how things are unfolding for this patient. So we need to be able to write it in a somewhat story-like form. So let's just break down what SOAP is. SOAP is, S is for subjective, which is what the patient is telling you, what their point of view is, their story. O is for objective, and that is for the exam that you're going to actually do and perform, what you see, what you've come up with, what lab tests you've done or diagnostics you've done in office, what did you come out with. A is for assessment. That is not a paragraph. Those are your actual diagnoses or your symptoms that you have come up with at this point. And we have P, which is actually planning. Planning is something like what we do as RNs as implementation. What are we actually going to be doing? How are we going to move forward? What is the plan? And that area definitely needs to include any labs or diagnostics that we order, whether it be in office or out of office. It should definitely always have a follow-up. And definitely you need to put any medications and any education that you talk about with that person, as well as any referrals. And any forms or anything like that should also be notated there, that you completed, that you've made a copy of, records that you've requested. So some of those things. So let's just go back for a second and let's talk about the S, which is a subjective. Now, we tend to like to put our own words into this area, and we definitely need to try to do less of that. And I mean that in the sense of don't use a lot of medical jargon in that area. I know sometimes we get brain farts and we can't even think of what a layman's term would be. So try to write down what the patient is exactly telling you and then formulate it in a better way so that it makes sense and it flows, but it needs to be notated. There should not be a 1 sentence or 2 sentence stating why the patient is here, because that is noted in the chief complaint. The subjective is basically a breakdown of what symptoms this person has had, what things that they deny having, what medications they're saying that they've taken or hadn't taken, what symptoms they've had, what events course led up to the actual moment that they've had these issues, if they have an issue. Even if it's a wellness, it should be stating what things are they doing wellness-wise, what things are they avoiding, what things are they actually doing that's making them healthier, what wellness treatments have they recently had, or preventive screenings that they've actually had. These are all things that are important in that area. And of course, you have your sections for your past medical history, your surgical history, your family history, your social history, your mental health history. Like all of those things need to be notated in that area along with medications. And then, of course, we always have our review of systems. You need to go through that. If it's a physical or a new patient of some sort, those all should be completed. Now, if it's more of a focused exam, definitely focus on those areas and those areas that could be related to some of those symptoms. Don't just focus on one thing. That should never just have one little thing that's actually checked off. One system that's checked off, It should actually have a general and then very specifics areas that you are going to ask about to the patient to be sure that they're not having symptoms related to it, or notating that they've made a comment to this area and stated that these things were going on with them, or they've had a history of something that may be important among the treatment plan that you're going to come up with. So now we have to go into our actual objective, which is our exam, which we need to be very clear on what we're supposed to do in there. Now, this is very important when it comes to billing, okay, and how you get paid, but we won't get into that detail today. This is not meant for that. But it's also something that's going to help. This whole note actually is going to help you, especially if something comes up when you think about court. If you miss something or you don't notate something within these visits that you're seeing this person for this particular issue, you're kind of going to be up the creek in that sense. So definitely make sure that you're putting a real story in there. And the objective definitely always has a constitutional or general. And that's basically to say how the patient is generally, or do they have anything that is significant overall that we need to be concerned about? Yes, you can put vital signs there, but normally in most EMRs, it's going to pop up in there somewhere anyway. You can put maybe that you review the vital signs to let it be clear that you know what's what's abnormal and what's not. Definitely moving forward, you should always have a heart and a lung check, because as we remember, there's always ABCs, and we want to make sure that airway and breathing and circulation is moving, because that becomes now our important focus if some reason that is off track. Anything else that they're talking about is probably either going to be happening because that airway and breathing situation, circulation is not going on, or, it just becomes secondary. So outside of that, all of your focused, you can either do by system or by particular body parts. Then you have the option to do during the physical, to do the whole system, meaning from head to toe, meaning you're not taking out body parts, you're just doing the whole system. But in more focused, less comprehensive exams, you can do more of a body part or a particular system based on what it is that they need. But I always tell people and my students, don't just say, if they say they're coming for a stomach upset, that's all I'm going to write. Don't do that. Make sure that you write about stomach, heart, lungs, and then there's a possibility there may be something going on with their urinary system. There's a possibility it could be related to, they still have some head stuff going on. That's why they're having stomach stuff too, or the head stuff is actually contributing to the stomach stuff. So you need to ask the right questions, which is, let me just go back a little bit to that subjective, which is why although the patient's going to be telling you actual events and issues that they're having, you need to guide it with your questions, and you need to be critically thinking through based on the things that they're telling you what the next question, intuitively what your next question should be and what things are the most important, because then it helps guide your actual exam so that you don't forget to check something or you're going to miss something. So again, this has to be a story. How does this story unfold? This is a novel. Patients are novels. They're not little short stories. They're novels. They're only a short story if they only come to you that one time for an urgent visit and you never see them again. But even then, you still want to be careful. So your patients are novels. So you keep unfolding. You keep asking. No, every visit shouldn't be an hour. However, you have to be proficient in your practice in order to get what you need. And if you don't really understand the concepts behind diagnosing mental and even spiritual health as a whole when you're dealing with your patients, then you're going to be doing very badly. I'm going to just tell you that right now. So next we have our assessment. By the time you've done those two sections, you should already have symptoms and or actual diagnoses that you're ready to put down. And I always tell people to always include their chronic, because more than likely those chronic illnesses contributed to the acute, and or you have to consider them in your treatment plan somehow. Those things don't go away. So they help you to know, they help the insurer, they help legally, they help you, they help the person coming behind you that you're still following them for those things too. And you're making sure that you're addressing them at every single visit. And which also should kind of fall into that subjective area. So if I have a hypertensive patient, although they're coming to me for something that totally has nothing to do with hypertension, I still have to ask that question. Are you taking those medications? Are you checking your blood pressure? Have you had any side effects or problems related to that? Because it could somehow end up being, attributed to why they're there for, especially if they're coming for like something like pain, or they have a sinusitis issue. And when I'm looking at vital signs, I notice that everything is quite elevated. And, so those things are important. And I need practitioners to really start thinking through and stop looking at parroting these previous clinical people that they've dealt with, or even physicians that they've followed that write minimal notes, and there's no meat to it. There's no substance. If there's no meat and no substance, you're setting yourself up for a lawsuit, and then you don't know how to truly follow up with this patient, because when they come back, you're going to be lost. You're going to be asking the same questions over and over again. Patients are slowly but surely becoming to realize that they want more from their healthcare providers. This is a customer service-based thing, not just disease-based. It's holistic-based. People want people they can feel comfortable with, that they can talk to, and they know that they're actually hearing them. And then when they come back, they're not looking at them like, who are you? They want to know that you've definitely heard them the first time. And when they come back, you're talking to them like you remember who they are, like you read through their chart, like you know what exactly you're following them up for, you're following them behind. Yeah, some of us see a lot of patients, so we don't always remember everybody's face. But if you have really detailed notes, you will know what you're seeing this person for. You'll know what to follow up with them about. I don't know how many times I filled in at offices, and I'm looking at this chart like, well, what is it that they're coming in for? Why are they following up exactly? What was the outcome of the previous situation? And it makes it really hard for the patient. They're very annoyed by that. And I am too, because it's like, I want to give you the best healthcare service that I can give you, and I can't do that if I don't have that information. So now we're going down to our planning. And our planning, again, is all those items that I listed previously, but you need to make them into a story. You need to give more detail. If I gave medication, shots, any procedure, that stuff should be outlined in my plan and part of actually my objective, because I need to state what the outcome was. So if I did an actual knee procedure, let's just say injection, because somebody had pain, along with just doing a general assessment on them, I need to notate what I did for that procedure, and what the outcome was, what medications I used. If I drew labs that day, I need to notate specifically what those labs were. If I did an in-house UA, I need to specifically state, and you have the option again of using objective or planning to put those results and what I decided to do. If I refilled medications, I need to state that. If they're going to continue the current medications they're on, I need to put exactly what all those things are in the planning. Do not just say, just continue, the meds, if it doesn't pop out, let's say on your EMR, what those meds are, or it's not notated anywhere on that note. You need to put that on there. It needs to be physically visible to someone who is going to go behind you, or that you have to send this note to. It's important. If I'm going to talk about, if I did any type of counseling and education, I'm going to specify what that was. What did I review with you? If I review diet and exercise, what did I say about diet and exercise? Did I tell you to do a certain times a week? Did I say increase certain types of vegetables or meats? If I'm talking to you about sexual health, what specifically did I tell you about sexual health? So that when you come back, or if somebody comes behind me and they say, oh, she never told me that, or he never told me that. No, it says it right here. They went over this specifically with you so that you could understand how to move forward for these things. So I encourage you and I challenge you to utilize Pearl 44 for yourself, not just for insurance and medical legal purposes, but for yourself, to keep you and your patient on a level of being more than just a patient, doctor, patient, provider type of scenario. You want your patients to feel comfortable and at home. Many people come in with these high blood pressures and anxiety because they're worried about what's going to happen, or they're already upset or angry because they haven't been treated like a person. They've been treated like a number or a dollar sign by someone else. Use that to help move your practice forward, help you to know your patients better, understand them better, know where you're going with things. No, we're not there to be everybody's friend and talk and gossip and so forth, but why can't you be a little more personable? Why can't you be a better provider by having these things available and doing these things in a more strategic manner? So let me go back and let's do pearl number 8, which I think I posted recently. I had to change up one of the pearls that were previously posted. And that's more or less speaking about your networking, your network. Who's around you? Who surrounds you? Who do you talk to about things? What colleagues do you deal with? What networking events do you go to? Who can you say if you need to refer somebody out for different things, or you just need to refer people, period? And it may not even have anything to do necessarily with healthcare. You just need to refer them out or refer a colleague to somebody else. That matters. Pick a network and keep a network of people that can help you in various areas, not just necessarily healthcare disease based, because your patients are going to come to you for so many different things. You're going to need somebody for so many different things, even for yourself to help you grow in your practice. But you need to get people of net worth, of real worth, not just financially, but their own network, their own brand, their own professional level is such a great one that no one could really say too much negative about that person or about what their business is, or how they handle business, or how they help people. You want people that people can say, oh yes, that's a wonderful person to ask these questions to, or to get this service from, or to do these things. You need a network that's worth of value, that's real value, because a network is how you're going to grow, period. Not just as a practitioner, but as a person and in your life. So if you don't have the right type of network, you probably want to reevaluate that. And you want to look at things. You want to ask people about their history and what they've done and what they're going to do to decide if that person should be a part of your network. You can have people that are kind of further out, like the backups, if you want to call it that. But those people that you keep tightly, that you would refer someone to, that you would look for initially if you had a question or you needed something, those people should be close by. Those people are the people that you should keep in front of you and always next to you. As people you can just speed dial, like, hey, I need you for this, that, and then they're going to work with you. They're not looking to hurt you. They're not looking to take ideas from you. They're not looking to, talk down about you to someone else and not help you move forward. You need people that can truly help grow your value down in the future. So I encourage you to keep the right network. I definitely do. So those 2 pearls are super important. I do a course, which I recently posted, and I would like for everyone to take a look at it. It is going to be at the end of February. It is for NP Pearl Survival. And this is for you to learn how to truly survive as a nurse practitioner in the real world, to get you started, because you don't really know until you get out there. And I talk a lot more about soap notes in a little bit more detail and go through them with examples and so forth. And I think it's important. I know that I've done a lot of mentoring. I went to a lot of site visits, and one of the horriblest things that I see is bad soap notes and people not learning how to write them. They don't even know really the purpose of them. They just know it's a note. They don't really understand the value of them. And my goal in my course is to teach you value of your job and your career and the things that you've learned. How does it really correlate? Everybody so all of a sudden has this surge to want to be a nurse practitioner. I'm going to be 100% honest. Everybody's not meant to be a nurse practitioner. Just because someone told you, yeah, you should go back and do it, or yeah, I think I just want to do it because I want to be at a higher level, doesn't mean you have to do that. We have master's degrees in nursing for so many things, but everybody is not meant to be a nurse practitioner. And if you're looking for an easy way to get up in the world or in your career, this is not it. This takes a lot of work, and it takes a lot of time to grow yourself. And you have to be open to new things, different things. Okay? You have to. So when you are ready for something, for you, definitely. So many of us put stuff on hold. We can't find jobs. We can't do this. We can't do that. That's great. But you have to find other ways to grow yourself. You have to find other ways to make yourself better in this area. Definitely. Okay. And again, you have to really decide if you're ready for this. This is a provider mindset. This is an advanced level mindset. If you don't have it, this is not for you. There's so many people getting out of school and they're like, oh my God, I don't know what to do. Why? If you have not changed your mindset while you were in school, when you get out, you're probably going to still be in that mindset for a very long time. And you're going to find yourself dealing with a whole lot more regression than a forward movement for yourself, in your career. You have to already have that confidence and that readiness to actually be able to move forward. So I encourage you to definitely think about this before you start just going and taking a class, and definitely decide where you want to be. We have so many certifications as nurse practitioners now. I don't know why they keep coming up with new ones, because I don't really see the purpose in them. We can have focuses without having so many different certifications, because most of us have done many different things. And those of you that haven't, I encourage you to do more. You will, as a provider, I feel like you have to have a well-rounded experience of different things. If you're only focused on one thing, you're not really benefiting your patients, because you can't educate them on different things. You can't help guide them when they need to be guided. And when there's other things from other areas that come and collide with what you're doing, you can't be a proficient provider without having more foundation. So I encourage you to really evaluate if this is for you, if this is where you need to be, if this is what you want to do. I encourage you to figure that out, because just going through the motions and paying the money and then feeling upset because you can't get where you want, or just becoming somebody's robot and do what this MD says or what some other nurse practitioner says, or to always still be working as an RN or always still working under someone, is not going to benefit you. It's just not. If you want to be a provider, you need to have the mindset of one like this. I got this. I can handle this. This is what I do. This is what I'm supposed to be doing. This is the job that I want. This is the career that I want. This patient is my patient. I'm going to take care of this patient. I know what I need to do to make them better. I know what counseling they need. I know what education they need. I know what medications they may need. I know what other options I can give them if they don't want to do medications. I know I need to include their family in things that I come up with. I need to encourage them to utilize their support system in order to move forward for different things. You have to think about all this. All of it is important, and it's part of what makes you a great practitioner. This makes you a great nurse, makes you a great medical person, period. But if you're not there yet, you haven't changed your mindset that I command this. I don't need anyone to necessarily always tell me how to take care of a patient. I don't need constant someone to constantly try to tell me what's okay and what's not okay. This isn't for you. This is not for you, and be sure to pick the right program and have the right set of people around you when you're doing the program that are going to help grow you, and not just keep telling you, oh, well, this is hard and this is this, and oh yeah, it's going to be hard to do this and it's going to be hard to be that. Find people that can help support your goal and your dream, that have the mindset that you need to have to help you grow in this area as you continue through. Even as nurse practitioners, a lot of us that are even been working for several years, we don't have that mindset. How many of them have been successful, or even, I won't say successful, but have just gotten along? I'm still amazed, honestly. You have to get your mindset ready. You got to be a boss. And I mean that in the sense of ready to be an owner of your own practice. And I don't mean physically you have to have your own practice, although I encourage every nurse practitioner to do so. And I encourage you guys really to honestly start going more towards a cash paying practice, a concierge type scenario. But that's a whole nother podcast. But you need to have that mindset. You shouldn't be thinking, I got to work for somebody all the time. I always got to have somebody around me to tell me what's going on, somebody to figure out my schedule and how to deal with patients and blah, 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 blah. You need to learn this stuff for yourself. which is why my NP Pearls workshop is such a great thing, because I talk about all that. Talk about soap notes. I talk about billing. I talk about branding. I talk about business. I talk about confidence. I talk about time management. I talk about all these different factors that make you who you are going to become and make you think about them. Make you feel like, okay, I need to sit down and figure these things out, because if I don't do it, I'm not going to be able to be as successful at this career as I want to. There's no reason why we can't be successful providers giving back to the billions of people in this world. There's not enough healthcare providers to truly take care of all of these patients. Yes, we need more, but we need competent people. We need successful people. We need people that are looking to network and collaborate with various people and move forward so our patients can get the best from us. We need holistic people. We need people that are not just looking at throwing pharmaceuticals at people or looking at the disease that this person has, but looking at the person as a whole, figuring out if they need mental health, figuring out how you can counsel them in those visits to help their mental health or their spiritual health. You know, being open to what other patients have to say about what they need for their health, what they would like for their health, what type of plan they see themselves doing with their health. These are important factors, and they all need to be a part of your soap note. They all need to be able to be things that you can include in your network, because some of these people should be in your network. So you can refer patients out to these people if you aren't able to do all of those different things, or you aren't always able to accommodate the things that they want to do. Even when it comes to natural health or holistic type scenarios, having someone that does that in your group or in your network will help patients. They will love you for it. They were like, oh, thank you for sending me to so-and-so, because they helped me with this part of my life, which makes me feel so much more fulfilled. And I know I got to come here and I'm going to do what you told me to do about this, that, and the other on this side of it. You know, you have to think about these things. It's so important. Healthcare is not disease only. You know, they come up with this word healthcare because we're trying to heal the body, but the body actually heals itself. But in order for it to heal itself, we have to be up to where we need to be physically. Even if it can't totally heal, but it still needs to be strong enough to do what it has to do. So everybody individually, as well as our patients, mentally, spiritually, and physically, have to be somewhat on the same level. And if they're not, and everything is off whack, you're not going to get the results that you're looking for. So I end all this podcast to say, look at your soap notes. Review your soap notes. Know that there has to be a story. Look at your network. Review your network. It's the beginning of the year. This is the time to review and get things right so that the rest of your year is a great year. And again, I want to invite those nurse practitioners who are interested to definitely come and be a part of Real World Survival Workshop for NPs. Please come. Check it out. It's posted on my Facebook page as well as in the Facebook group. The link is also on events.com. Definitely come and check it out. It won't be a big giant event. I will continue to have more events coming up for this same thing, as well as additional classes that are going to be very different from some of the ones that you guys see posted. It's not going to be the same old typical stuff that you guys are going to and trying to get skills on that have really nothing to do with your practice and you don't end up actually using. So definitely come and be a part of it. Come check it out. There's going to be small classes, more one-on-one, more realistic type training and interaction so that you can really ask the questions that you need to ask. Look forward to meeting and speaking and seeing comments very soon from all of you. And be sure to have a great year. Start planning your goals. Do a vision board. Do everything you need to do in order to help put you on that road to positivity in your networking and career as you move forward, as well as your life. You have to take care of self. Thank you for joining me here at Dr. Brandy's Pearls. And I will see you guys next time with a whole new podcast and a whole new conversation. Have a great, great, great week.